Thank you. And I'd like to welcome everyone to our 2026 ARCA Virtual Learning Institute. For those who've been part of it for the last 2 weeks, we're so glad you're back. We have this week and next week for our live presentations and invite you to attend those. They are being recorded and put on our website as soon as humanly possible with captions for those who are not able to attend the live sessions. Today's presentation is Clinical Strategies for Supporting Families with Neurodivergent Needs. Dr. Melissa Franzen comes to us today, and she brings over 20 years of clinical experience to an ever-deepening commitment of practitioner wellness, engagement, and neurophysiology informed practice. As an LCPC in Illinois, her background spans social services, foster care, residential, and detention facilities, as well as private practice, shaping her focus on intersection of human biology and professional sustainability. Her current scholarship includes 2 distinct emergent lines of inquiry. She's a co-developer of applied polyvagal model in clinical supervision, which integrates the autonomic safety and co-regulation into the supervisory relationship. Independently, she's developed Abound. It's a framework, conceptual scaffold for neuro-informed practices designed to cultivate, to ground, and durable presence in ethically responsible relational growth. Just as a quick reminder, we ask folks to keep your mics muted. We will be monitoring questions in the chat, and Dr. Franzen has asked for this to be interactive, so please be sure to put your questions in the chat. And with that, I'd like to go ahead and turn the floor over to you. Thank you, Dr.
Wonderful.
Franzen.
Thank you so much. I appreciate so much being asked to be here today. As Christine said, I have a long history working in the clinical field. And as my slide says, I also am a counselor educator. My background, I am doing private practice through my Growth Abounds. Well, in Illinois, you have to say Growth Abounds, PLLC. And so there's that. But the piece that doesn't come from the books and the piece that stirs the heart of what I do and my passion in what I do is I'm also a mother of a 19-year-old son with complex neurodivergent needs, and learning to grow with him and learning the work I am doing and bringing here to you today has been on my heart and a passion that I have felt led to do for quite some time. And so I thank you so much, ARCA, for giving me the opportunity to bring this information forward to all of you. As Christine said, I am also one who enjoys interaction. And so please feel free, if you have questions, throw them in the chat. Christine will bring those up to us as we're going through this. As we learned earlier, I'm not a tech savvy person, so we're going to let her throw those out to me. And so we are able to keep the slideshow up and running for you all in a way that is effective. So today, welcome. And today we're going to talk just a little bit about like the needs of families who have individuals in their lives with neurodivergent needs, and how that can look a little different than what we're used to, and how that approach needs to shift a little bit. And so what I hope you take from today is a deeper understanding of what those needs are, as well as a new pathway for you to step with these clients and move forward with them, helping them strengthen their daily presence and their family functioning around all of the needs that do exist. The core idea here is going to be shifting this concept of that, like, well, I'll go into a little bit more, but the medical side of like fixing the neurodivergent traits that exist, from that to supporting the family and supporting the children in those families with those needs, or the individuals, because they could be adults. The chronological age doesn't really change what their developmental needs are, because everyone has needs that are individual and unique to them regardless of their chronological age.
Excuse me,
So
Melissa.
let's
I apologize for interrupting. We had a request. If you don't mind speaking just a little bit louder, you're a
Oh,
rather quiet
absolutely.
speaker, and that would be helpful.
I sure can. Is this better? I can also try to take off my mic if that will help.
I think that sounds a little bit louder to me. I appreciate it. Um,
Okay,
Cindy,
let
is
me
that a little bit
let me
better for
shimmy
you?
this in here a little bit.
There you go.
For those
Perfect.
participating, can you hear that a little bit better? Okay, I'm going to assume that's a yes, because I don't see very much, but if it's not, please let us know. And my apologies. Let's go ahead and dive in. So as I said, we're looking at a shift. Our medical model says we look at the needs of individuals in this form of pathology, that it's something we need to fix. And when we're working with an individual with neurodivergent needs, my goal is that you're looking at this from that more neurodivergent affirming approach, as opposed to this fixing medical model. Um, Previously, this medical or behavioral model is looking at external compliance from these individuals, and how do we reduce the symptoms? How do we reduce the stimming or the vocal tics or whatever it is that causes an individual to feel uncomfortable out in public, because that's other people are uncomfortable, and that's what it was always looked at. Now, as I said, I have a passion for this, so I'm going to try not to go off on that pathway. But that's not what this is about. Trying to force someone to comply with external expectations when their internal developmental neurological needs are screaming they need something else does not work. And it causes burnout and exhaustion in all the family members who are engaged here. It causes that exhaustion in the client, in the child, the individual with those neurodivergent needs. And we're treating them like there's something to be fixed. And I'm just not okay with that. And I hope you're not either. And I hope that's why you're here today. So what we want to look at is this neurodivergent affirming system. Okay. We're looking at an affirming practice that's going to validate their neurological needs and differences, and look at it as if it's just a natural part of who they are, not something they need to pathologize and something they need to fix, because that's not where we're at. What I love about this approach overall is how we are looking at, again, not just fixing one individual, we're looking at prioritizing the needs of not only that individual, but the family as well, and the safety for the family and their regulation over what these external behaviors are, and over that compliance that is being demanded in that medical model. Now, I will tell you, as a parent of a child with these needs, that is a hard thing to shift. It's a very hard thing to shift, because in our raising and in our culture, we have all been shown that behavior is this, and you change it and the child complies to the parent, and all of these like demanding things. And so as parents, we feel like that's our expectation. We have this core belief that as a parent, my job is to make my child learn and do right. And I know that sounds a little harsh, but at the bare basics, that's what we're taught. But when you're engaging with a family who has these neurodivergent needs, we need to support them in shifting that mindset, shifting from that compliance to that internal safety and well-being, because that's how we're going to move forward. This is so critical when we're working with affirming care and prioritizing the individual's internal sense of safety and the family's internal sense of safety rather than forcing this compliance. Because often all that does is a power struggle that no one wins, not a single person. And it just leads to more behaviors and stress. And again, that burnout, that exhaustion of how do we even keep going? And so today we're going to look at how we can shift that focus to help that keep going be based on that safety and that durability of working forward and not fighting for compliance. Okay. So before we jump into some specifics of that, one of the things that we need to raise awareness to is this grief that exists for families and individuals, and especially parents, when they discover and learn that their child is going to have these neurodivergent needs. It's a real heavy thing. And as clinicians, we have all learned about grief and how grief is not, linear. It is all these different stages that can kind of bounce back and forth. But there's an end game with grief. There's a goal of learning how to move through the grief and learn to live again in a new way without whatever it is we're missing and losing. But with our families, this non-finite grief is different. It's not something that we just see as having like a final stage. It's something that is reoccurring and it's persistent and it is triggered many times over. It's triggered by the gap between a child's developmental abilities and realities and those social expectations. It's triggered by different clinical markers of these milestones that a child is supposed to meet or an individual is supposed to do, whether that is walking, talking, just general communication, engagement with you, going from that parallel play to playing together and seeing the responses. It can be school transitions that look different. All of these differences can lead to what we call chronic sorrow. When we're working with these families, we need to help identify these various markers for them and help them work through what this looks like, because that is how we're going to help address that burnout and exhaustion. We're meeting them where they're at and saying it's a thing and it's okay that you're experiencing this. And I'm not sure, and if any of you have had this experience with your clients, please join in here, throw it in the chat. What are some of the things that you have done to help support them? Because when we're looking at this, we see this conflicting joy and grief all at the same time in parents, where they love their child and are feeling so blessed and happy and watching them make these minuscule little improvements every single day and overcoming these barriers every single day. And we want to celebrate that. But then inside, we have that ambiguous loss. We see our child there, we see our child doing things, but it's not the child I expected when I found out I was pregnant. It's not the path I had envisioned when I thought of my son's future. And for me, it took a long time to work through that and not hate on myself for feeling grief about what's not there, to not berate myself, to tell myself, you shouldn't be sad or feeling grief. Look at your son. He's here. He's alive. He's functioning. But without getting support and help myself, I don't know how quickly I would have been able to overcome that, because it is hard and heavy. And in our world, we know what we're shown. And for so long, what we are shown is that neurotypical ideal expectations that advertisement puts out there and TV puts out there, and that general expectation. And so working with these families, meeting them in a place where they are at, holding that safe space for them to experience this loss and this sorrow and this grief, that is the first step in helping these families. Acknowledging for them that this is okay. It's a yes and. Yes, this is heavy, hard, sad, and we can see the joy and let it be beautiful. You can have both feelings and not be wrong. And we can look at how to help them shift and work through some of that loss, knowing that it's going to come up again. And we help them prepare for that. And then we help them look at that joy again and move forward with the joy in those situations. I want to pause real quick just in case anyone has thrown anything in the chat that they wanted to share on that topic.
Nothing in the chat at this particular point. If
Okay.
folks have any questions or thoughts, please put them in.
Thank you. So what I love about this image here, and I have to admit, I did not create this image. I had help with AI because I am not the tech savvy person to make this look pretty. But looking at these, that swirl, that cyclone, these different feelings are going to keep popping up, but it's not in a planned, conditioned, oh, I know it's going to happen. Different milestones or shifts will cause those to come up. When they're really little, it could depend on when you learn about the needs. You know, if you learn about it right away, then you're looking for those changes and you're looking for those differences. If you don't learn about it until they're a little bit older and you don't have that confirmation, we have a different view as parents on, oh, they're just developing a little bit slower. But then having the confirmation of it's a little bit slower and it's going to be a thing. Like this is how they're going to develop. That shifts the perspective for the parent. And then that's when they start seeing kind of that loss of hope, that ambiguous loss popping up over and over again. It can be when they enter school. Some of them have to get held back a year depending on what services the school has. As they grow a little bit older, you have the kiddos going into sports and activities, and some children can do that. My son was one who was able to participate in the sports, but at a different level. And we were blessed to be in a small town where they were very inclusive for him, and it gave him those opportunities. But as the parent, I still saw the developmental difference. And I saw my son's disappointment at times when he couldn't do things just like his peers. And so those times hit me unexpectedly. And those are the times that we want to help those parents understand that it's okay to meet with that feeling and feel that feeling and still be present, that yes, and that we can carry both of these and move forward. That doesn't have to stop you in that path. And I think that's one of the biggest things here, in addition to meeting them there and giving them that safety to feel those feelings, is also helping provide them with that hope that this can exist and things can keep moving forward and you can keep developing and you can enjoy the joyful moments that you are part of. So how do we start doing that? There's a lot of different approaches out there that you can use. What I am presenting you today is an overarching view of what I feel and what I have seen some of the most successful ways to do that with these families. But this is where it's hard, okay? This is that moment where we say, hey, we got to kind of go against those expectations of what we thought we had to do as parents and what we thought what it meant to keep our child safe and what we thought it meant to teach our children, how to behave and how to act. We're back to the expectations, right? And also to go against the societal expectations. Let's pause for a moment.
Yeah,
I
Melissa,
want you all.
we have a couple
Yeah.
comments in the chat. So Heather shares a beautiful piece. When my son was in third grade, he learned how to pronounce mommy with both
Oh,
M sounds, and that was a big moment for me. And I had to break down hearing it for the first time. And Karen adds,
absolutely.
yeah, and Karen adds that Welcome to Holland essay by Emily Pearl Kingsley is worth reading.
Okay, absolutely. I will write that down. Not at this moment, but if we keep the chat up at the end, I'm going to write that down. Thank you for that recommendation. I'm always looking for new reads and new viewpoints and new stories. So thank you for that. And Heather, thank you for sharing that moment. As soon as Christine started reading it, I felt it. I felt it in my heart and in my chest, and just had another one of those moments, those like, oh, that's a yes and moment, right? You mentioned breaking down when you heard it because you're so joyful and so grateful to hear that sound for the first time. And that loss, that non-finite grief is still there at the same time. And you have to carry both of them, even though it's a beautiful moment. So thank you so much for sharing that. Oh. Obviously, I'm an empath and a feeler. And I get all up in my feelings. So thank you. Okay, so now we're going to take a moment and I want you to imagine that you have taken, and we're going to do a younger child, but it could be an older child for you too. So whatever fits your comfort. Imagine you are in a grocery store with your child and you're walking through and you're trying to get your stuff done and you're grabbing things and you're looking over here and you're going over here and all of a sudden your child starts grabbing stuff off the shelf and throwing it. What do? You turn around. Our natural instinct is stop it and go pick up the stuff and put it back on the shelf. Don't touch anything. That's a natural response. We have to control the situation. I'm on a mission. I'm going grocery shopping. I got to get my stuff done. We got to get out of here. We probably have t-ball practice. It happens again. And it happens again. And then the next time you correct your child, it turns into a full-on meltdown. Now, I'm not going to scream. There's a microphone here, so I'm not going to do that to you. But you know what I'm talking about. the screaming, the crying. If they're not inside the cart, they are probably now on the floor, flailing in the middle of the grocery store. And I want you all to feel how that feels for you in that moment. And now you have people walking by, staring at you. How are you feeling? What's the response you feel like you're supposed to have right now? What's the response you saw growing up when it would happen? Then you have someone stop and tell you, you need to get control of your kid.
We have mortified, embarrassed.
Yeah. Then you have someone come by and say, all that kid needs is a good whooping, and they'll stop doing that. How you feeling? I would have all those feelings and anger and then sadness, because my emotions come out in tears. And you're in the grocery store and all you're trying to do is to get done and get out now. Our instinct is to pick up that kid, set him on the cart or stand him on the cart, whatever you need to do to get done and get out. Or there were times where I grabbed my kid and I left my cart and I left the store. Because I was like, that's what I need to do. I'm not going to stand in here while they're throwing a fit and nothing. No, I'm not going to, in my head, I'm not going to reward that behavior. We're just going to leave. But holy cow, did I just miss an opportunity? So this is what the hard stuff is. This is the hard part that we're going to try to teach these parents and help them with, is we need to shift. We need to shift our mindset. So to start doing that, we need to remind our parents that yes, it's hard and we can be flexible. The caregivers, as you see, they are the anchor in this situation. How they respond is going to dictate and direct whatever happens next with their child. Because when I grabbed my child and I just left, as the parent, I thought I was teaching him a lesson. As the child, he just learned that his needs, whatever they were, don't matter. Sit with that for a second.
Melissa,
When I said that, did anyone go, but?
Yeah,
Go
we have Marissa who said happened many times with my daughter when she was young. And I would think, why can't she be normal? And what's wrong with me as a mother?
That's a heavy statement. And it's where we go as parents. We have that core expectation, that core belief that we are supposed to be able to do everything perfectly and control them and, make sure these things don't happen. But I hope you learned that there's nothing wrong with you as a mother. And that we're not supposed to control the situation in that sense. Because when our children have needs, our job as the parent is to learn what they are. And that's very different than the controlling, fixing mindset that we are so used to. So I want to make sure I keep an eye on the time here. So first step, one way to approach this is looking through the eyes of acceptance and commitment therapy and the concepts that it brings with us. We help move the parents from that reactive crisis management response, the I'm going to control this, into what we call psychological flexibility. The primary clinical objective here is that we are going to help enable the parents to take a value-aligned approach or action even in those moments that are high stress. And nothing is more high stress than when you're in public and this is happening. Because at home it's stressful, but in public we're dealing with everything else, the judgment, the stares, the expectation. So we're going to work with them to start being flexible. It's going to be the hardest step because we are conditioned to not respond that way. So what we're going to do is we're going to look at, excuse me. How can we do this? How can we show the parents that they are stable and able to do this? I want to go back to the comment that was shared where you said, like, why am I failing as a parent when these behaviors are happening? So not only do we feel like we have to control it, we've convinced ourselves that we're not a good parent. So that next step into introducing that psychological flexibility of, hey, we don't have to have this rigid approach, is to then help you remember your efficacy as a parent, or your clients, their efficacy. You need to help them build that sense of, I am able. I am capable of doing this. I'm capable of caring for my child. I'm capable of giving my child what they need. Because with all of that grief and that sadness comes a whole lot of self-doubt. And so we need to, help them rebuild. We want to empower the parents to identify their values and their strengths over the fears or the flaws that they are seeing. So we stop and we help them identify, who are they as a parent? They're loving, they're kind, they're supportive, they're hopeful, they want the best for their child. Notice that I didn't say they're controlling, they're right, they're powerful, they're solely responsible. I didn't use any of those. We want to look at their values and what's important to them and help them reinforce those of, okay, then what does that loving and supportive and kindness, what does that look like in your parenting? Okay, so that's 2 steps so far. We have said, hey, we need to be flexible. We have to stop that I have to control thoughts. And then we have to identify who you are, what a great parent they are, and the strengths they have within them. So yes, I accept I am a parent, and yes, I accept that we have hard situations, but this is who I am, and this is how I want to lead. For some parents, they may have never been told those positive things. So this might take a little bit longer in helping them identify them. You might even have to go to something small. Like, your child gets scared at night and wakes up. What do? You don't run in there trying to control it. You run in there and say, oh, honey, what's wrong? And you hold them and you love them. Those are all examples of those values. In that low stress situation, they responded with the value and the love, not the control, not the expectation. Helping them see those small kind of lower threat levels of how they are responding with that value aligned action can help you build it for them. And we help start growing it. So step 3 in this first phase is the hard part, the accepting discomfort. So while we have said, okay, we're going to be flexible, and we said, this is how I want to lead, in the face of those high stress situations, we have to be willing to sit with the discomfort of that, like, oh my gosh, why can't I control this? Oh, they're staring at me. Listen to these comments they're making. They're telling me to control this. The butt whooping I heard more times than I can tell you. And I had to sit with that. And for me, I had twofold. It gave me that, oh, I need to be able to control this, but it also gave me some anger. So I want to acknowledge that, because your parents might bring that out too. Like, how are you, the stranger, gonna tell me what my kid needs when you clearly don't understand them? And so that ability to sit with that discomfort when it's hard and still choose those value aligned actions, it's what's going to help them take that next step forward. That's going to be for the greater good of their child and their family. But this is something both parents have to get on, or any caregivers that are part of the support team are going to have to get on this level to be able to do this. Because as you get them to that point where they're able to say, I can be flexible and I can follow my values and I can sit with that discomfort, that belief in their self, that increase in their own self-efficacy as a parent starts going way up. And I have the efficacy metric down there at the bottom, and it's so true. As their efficacy goes up, our research shows us that that is one of the primary leading predictors of that improved long-term stability within a family, because they are starting to believe they can do it, even though there's hard and even though there's discomfort. Okay. Now, we've all seen an iceberg before. I know you have. It's in all of our books for various reasons, but I couldn't help but use it here. So now we're saying, okay, I can do this. I got this. So how do I do this? And this neuroaffirming framework that we are using, we look at these challenging behaviors and we redefine them. So we see the meltdown, we see the throwing of the items, we see the fit in the grocery store. But instead of saying they're being defiant and they're not listening, we go at them with curiosity. Because what's going on right here is that there is some need that they have that they are not able to communicate. So that behavior is not defiance, it's functional communication of whatever their unmet need is, or that skill that they don't have that they're trying to execute. So the behavior is just our tip of our iceberg. That's all you're seeing above the water. You're just seeing the behavior. And if that's where you leave it, that's all you're going to get. But if we understand that just below that behavior is this gap, so the executive demand gap. Now, this kind of comes from a combination of a few things, this terminology. Dr. Green in 2018, his collaborative problem solving model. And then we also, there's a great article, it's resourced at the end, Lerner et al., it's 2023 article. They talk about this neuroaffirming care. And when we put together that collaborative problem solving with the approach of the neuroaffirming care, we're seeing that the executive demand gap occurs when the environmental expectations, everything going on outside of our child, exceeds their ability and their neurocognitive capacity to do the thing, to communicate whatever it is they need. This external is not where they are at. And so when you see, look a little bit lower here, that sensory processing difference. So because of wherever they are processing at, whatever their ability is, whether they are over responsive or under responsive to whatever externally is going on, it's because there's this gap in their ability between that and what the expectation is. And so what we get is the behavior because that communication ability is not there. And then underneath all of that, we're going to touch on here in a little bit, is that nervous system. Constantly acting in overdrive. Most often sympathetic overdrive. You may have some who go that more dorsal reserved route, but most of it is that sympathetic overdrive. And most of us know that as that fight or flight. So that's what we're seeing above the water, is that inability to regulate that and meet whatever those expectations are because of their own abilities. And the level that they are able to function at is different than what's being expected out here. So what do we do here? Remember when I just said we're going to talk a little bit about that nervous system? This is where we do that. So yes, I know we were just talking about our child's ability. But here's the thing. When you're the parent standing in that grocery store, trying to rush through and get the grocery shopping done and get to t-ball practice and get dinner made and get all those things going, you yourself are dysregulated. Because we don't function clearly in this survival state, right? When we're just trying to do. That's not how we were designed to function. And so if you're dysregulated in that moment, your child's going to stay dysregulated. And this is where I wish we were kind of in person. I like shows of hands, but how many of you have started looking into the research on our nervous system? Dan Siegel early on introduces us to this concept of the window of tolerance. So that optimal ventral vagal zone where we are able to function while allowing ourselves to navigate these daily stressors that come up in our lives. Whether it's the grocery shopping trip or it's the delay in getting ready for school in the morning. If we are within our window of tolerance, we are able to navigate it as the parent and be present for our kiddos and move forward, right? But if we become overwhelmed, if we get dysregulated, we go in two different ways. For those who have not read or looked into it, in addition to the window of tolerance, look into Stephen Porges's polyvagal theory. Deb Dana does an amazing job in taking it and applying it to therapy as well. So with this, it's saying when we're dysregulated, we're going to go one of two ways, right? We're going to either go to our sympathetic response, which is that we call fight or flight, but I want you to think of it more as mobility. So when I'm standing in that grocery store and my child's flipping out, I dysregulate, and my home away from home, my response is sympathetic. So I'm going to mobilize, which means I grab my child and we left the store because my body felt like I was not safe and we needed to do something now. Other parents or other individuals and children for that matter, if they don't go to that sympathetic state, they go to that shutting down state, that dorsal state. So they might not do anything. They might just stand there and not engage at all. And not as an active choice or this is how I'm going to respond so the behavior stops type of way, but I can't be part of this. Or maybe they just walk away and start getting in the rest of their groceries and leave their child there, throwing the fit. Both of these are opposite extreme reactions, but it's a dysregulated parent, a dysregulated nervous system that causes those choices. So once we have gotten our families this buy-in of I need to be flexible, I have that own self-efficacy of I can do this, I can be this parent, right? And we're moving forward with, okay, now we got to enact this. The next step is when they're in that moment, they have to be able to regulate themselves. And I'm going to give you a quick kind of 1, 2, 3 here in a couple slides of a way to do that. The reason we do this is because if we can help our caregiver get regulated and get back into their own window of tolerance, when you are regulated and you're in your ventral vagal state, you're able to access this prefrontal cortex. You're able to access the logic and decision-making skills that you have. That self-efficacy, that awareness of I am a good parent and I can move forward with love and validation and all these things. You can't access that until you're back into your own ventral vagal state, until you are regulated. And once you are, the cool part is we look at this autonomic co-regulation. Because when your nervous system is ready to move forward, then your child's nervous system feels that safety. Now, I real quick want to say, this does not mean when we tell ourselves, like they're angry and they're flipping out and they're doing the meltdown, and you're like, okay, I'm going to keep my face calm. I'm going to talk in a voice like this and say, honey, I really need you to do this right now. You see the tense jawline. You feel the, I'm not calm. Well, our kids do too. And for so long, we think that that's how we need to do it, but we need to go more than just putting on a calm appearance because their nervous system feels our nervous system. So no matter how calm and how smiley you are and how soft you talk, if you are not regulated, they feel it. So once you get to that regulated state, there's this physiological process that allows your nervous system to be that signal of safety for your child or the dysregulated individual that you are with. So we are shifting the parent's role from that control, that external expectation, to what is their internal state. Your role and the best thing you can do in this moment for your child in any of these challenging situations is to show up regulated. Because as a dysregulated caregiver, you cannot effectively facilitate your child's co-regulation. So staying within that window of tolerance, that ability to be calm in the storm, so to speak, that's how you're going to help them. We're looking at this from a bottom-up approach. So we're not thinking logically. We're not trying to explain anything to our children. We're not trying to explain anything to ourselves in that moment. We're starting from the bottom, that nervous system, and getting ourselves regulated. Now, this can be done a number of different ways, and depending on the individual, you may have to look at it differently. For some who need more of that like shutdown, relaxing dorsal approach, you might look at box breathing, or you might look at the 5-4-3-2-1 method. If any of you have done that, looking at your different senses, right? What are 5 things I can see? What are 4 things I can hear? And you go through all of your senses, and it doesn't have to go in any particular order. It's just easier doing C for 5 because it's easier to see 5 things than it is to taste 5 things, right? So helping them ground themselves and like, okay, hold on, what's going on here? I need to stop my like automatic response and need to control this situation and get myself back to that regulated state. Okay, so now we're grounding. Now, if you have someone who's more sympathetic, like I am, maybe it has to be physical movement to ground. I might need to get up and bounce on the balls of my feet for a second. I need to shake out whatever's going on because I need to move and my body's saying grab that child and get out of the store, but that's not what that child needs. Maybe it's some simple bilateral tapping. Cross your arms and alternate the hands. Just take a breath or two and just get yourself moved and refocused. Some simple, quick things to start engaging your nervous system to get it re-regulated. Okay. Ooh, yep, we're almost there. Okay. So as we're doing this, we get re-regulated. Okay. And now we're present. So then our nervous system will be present for our child. So instead of looking at that child won't do something, we think to ourselves, oh, they can't right now. Not can't forever, they can't right now. So what is it that's missing? Okay. What is it that they're needing? So we go to this collaborative framework from after shifting that lens to curiosity. What is the problem? What is the need? What stressors are demanding of them right now? And where are they at? So the ultimate goal of this is not like an absolute independent that they're going to be able to fix this problem on their own. But the goal is that interdependence, that ability to help your child use who is with them, that regulated nervous system, and rely on the supports that are around them to work through whatever it is they have going on, because you're showing them that it's okay that there's a challenge right now. And you're here to listen and hear and try to learn. You want to know what it is. And sometimes that requires you, and most often as the parent, it requires them to say what's going on in their own mind, and then tracking what's happening with the child. Okay, you're really interested in this right now and you're not wanting to move on. I'm wondering, are they hungry? Is there something about that box they really wanted that snack instead of the one you got that they keep throwing out of the cart? This is where that flexibility comes in as the parent. Does it have to be exactly the way we planned every time? No. And as the parent, that's hard because then we're like, oh, like I'm letting them win. I'm rewarding this negative behavior. When really the child was just trying to tell you in that whole supermarket situation that they wanted the strawberry applesauce instead of the regular one that you just bought. And I know that sounds simple, but that is as simple as it can be. And as simple as it often happens. But if you don't shift your lens, get regulated and shift, and then look at that, you're not going to learn it. And then that child just relearns that what they want or need doesn't matter. And I'm not saying that they can do that every single time, but you need to get your parents, help them get to a point where they can be flexible enough to ask, where are we at? Okay, so we only have a few minutes left. So let's jump to, in my Abound framework that I have developed, the Abound framework is the practice of durable presence. So whether as a parent, as a teacher, in your daily lives where you're working as a supervisor, what have you, there's a moment where we need to work on our own regulation to be able to be present for those we are engaging with, to provide an opportunity for the most productive, positive interactions and progress. But when we are in a moment of stress, right, It's really hard to do that. And as clinicians, we also try to give our parents great strategies. We can give them scripts to use. We can give them behavior charts. We help give them like the logical consequences, or even like my favorite is natural consequences. And we focus on them. We say all these things can happen. But when you are in the middle of a stressful moment, those cognitive tools are top down. So they require you to be able to access that prefrontal cortex, which we just learned you don't do if you're not in a regulated state. So one of the quick ways to help them remember how to readjust is this tool I call the pivot. And for any of my friends fans out there, yes, that is exactly what I thought of when I thought of pivot. Trying to get up the stairs with this couch and it's not moving. And the one parent is just, Ross in this case, yelling, pivot, pivot, pivot. And the other two people there don't know, like they can't pivot. That communication is not happening because what's going on does not fit what the demand is. So for our parents, how do we pivot live and in the moment? So quick 3-step to try to remember: regulate, reframe, collaborate. So it's everything we just talked about. First, they need to regulate. Stop. Don't talk. Don't say anything. Don't think. Don't try to fix. Just stop for a moment and check yourself. What do you need to get regulated? And do it right in that moment. Deep breath, box breathing, the tapping, the movement, whatever it is, do it in that moment. And then reframe. Look at what is going on from that view of curiosity and empathy. Because if you do that, the parents will be a lot less quick to do that reactive punishment. You're throwing a fit, you're not getting this. You're doing that, this is not happening. Once you're able to stop yourself from doing that, it's that collaborative curiosity over the control of the situation. What is it they are needing? And again, this is that hard part, y'all, for the parents especially, because we are ingrained to feel like we are supposed to control. And we have learned that if we even wonder about what the behavior is, it's viewed as giving into it. And that's the part we need to throw out the window. Because for our child who cannot communicate in the same way as we do, who are dysregulated and are not able to access that prefrontal cortex, for which most of them is not even fully developed yet, we have to provide that opportunity, that space for tolerance and curiosity to understand and to show them my regulated nervous system is here safely for yours, and that it's okay that this is a hard moment and we'll work through it together. And the more they're able to do that, the more we are able to help them move forward. And then that's what provides that shift in the whole family. Everyone taking these opportunities. And this is just an overall picture of what it is. I think we're right at time. 2 minutes. So all of the resources are here at the end. Please feel free to jump through them. And then this is a QR code that goes to my DOT information. So all the contact information you see up there, if you just screenshot it, that will take you to my DOT account, where you can get my contact information. Feel free to reach out to me anytime, any questions. There's also an opportunity on there, once you click through, that you can leave your contact information as well. And so please feel free to do so. And I know that's a lot. So questions, I know we're right at the end.
Yeah. Thanks so much, Melissa. We had a couple comments. One is siblings feel this way too. So this can really be helpful for siblings. And then I was back channeled about being a caregiver of somebody with dementia. And those caregivers go through a very similar kind of experience. And so this can be invaluable. And I think what I was really it captured me is, even if we're not working with young children, We may be working with transition age or even adults who experience this. Having that understanding of what the family members are going through can be incredibly helpful in our services with that particular client. We don't have to be working with the family to have a fuller understanding of what they're going through so that we can really be present with our client by understanding what families are going through. And then we can offer these as little toolbox helpful information for family members.
Absolutely. And that was the driving force behind my Abound framework, is helping everyone learn. Sorry, my cats have decided they're trying to come join us. Helping everyone learn that we all have the potential to show up in a way that we can be curious every day, even in high stakes situations. And that's going to lead to our long term, and I call it durable presence, where we can show up continuously without getting burnt out, without those external pressures and expectations that someone else has decided is what we needed to do. But truly, we can show up in a way that we are regulated and present and leaning on our values and what's important to us, and then move forward, no matter what the situation is. And then we can help our clients and their families, the siblings. I do with the Abound framework, well, Christine, I told you, I have a training I've developed for parents specifically, or caregivers in general, because it can be foster care families, it can be biological families, it can be grandparents raising the children, it can be any of them. And there's this way we can show up. And within that training, I have a few more steps and kind of more detailed resources and stuff. So please feel free to reach out if you have some questions about that as well.
Well, thank you so much for bringing your information to us. Truly appreciate it. And I hope to be able to see folks at tomorrow's presentation as well. Truly appreciate your engagement and the expertise of our speaker today. Thanks so much.
Thanks, everyone.